Regina is our next case. The patient has a combination of both migraine and tension type headaches.
Regina, how long have you had headaches for?
Oh, I've had headaches for about 20 years now, since I'm about 25.
And what type of headaches do you have?
I have two types of headaches. First, I have what I consider my pure migraine. These headaches pretty much focus around my right eye and on the right side of my head near my scalp. It's a throbbing kind of headache, and I usually get those once or twice a month. Secondly, I also have a tension type headache, and those headaches are a little different. They generally start at my neck and they radiate up to both sides of the front of my head.
Does the first headache, the migraine headache, is that type of headache associated with other symptoms?
Yeah, I do have, usually I experience nausea and sometimes vomiting. I'm very light sensitive and sound sensitive. Normally I have to go into a dark room with these type of headaches. It's an extreme throbbing headache.
Now the second type of headache, do you have symptoms also?
It's different. It's more of a constant ache type of a headache. I don't experience nausea with it. I am light sensitive, but sound doesn't seem to bother me.
In a scale of 1 to 5, how would you classify the migraine headaches, with 5 being the worst possible pain?
Sometimes they can get as severe as a 4, I would guess, about a 4.
Okay, and the second type of headache that you have, what would you classify that pain?
Somewhere around a 3. It's not as severe as the migraine.
Okay. And what medications have you been taking for the migraine headaches?
I've been taking the sumatriptan nasal spray. That's usually my medication of choice, and that seems to work after about 30 to 45 minutes after the first spray. The headaches seem to be relieved. Sometimes when the headache's very severe, I have to take a second spray, and that usually takes care of it.
And what medications have you been using for the tension type headaches?
Well, originally I was taking pain medications like aspirin, Tylenol, Advil, and sometimes when they were more severe, fiorinol with codeine. That would usually dull the pain, but would never really take it away.
Okay, I want to ask you, do you have family members with migraine headaches?
Yes, both my mother and brother have migraines.
Both? Any other members of the family with migraine headaches?
No, not that I know.
Okay, now let me summarize what you just said. You have two types of headaches. You have migraine headaches and tension type headaches, and both types of headaches seem to respond to the sumatriptan nasal spray. Is that correct?
That's correct. It seems to work for both types of my headaches.
Regina, did you have any complications from the pain medications when you were treating the tension type headaches?
Yes, I did. There would be drowsiness, and sometimes it would irritate my stomach, and so that it made me uncomfortable with the pain medications. I wasn't able to freely work the way I could.
And when you started using the sumatriptan nasal spray, what happened?
There weren't any side effects associated with that, and it made me much more functional.
Regina, it seems that using the sumatriptan for both your tension headaches and your migraine headaches is doing well, and it seems like that we're on the right track with the treatment.
Yes, I agree with that.
Regina uses sumatriptan for both types of headaches. The Spectrum study showed that sumatriptan would work for multiple headache types, provided that one had migraine headaches. She also uses sumatriptan for her neck pain prior to the development of a severe headache, and there is faster relief of the pain if she uses the medication